Hello, my name is Alexander Hauenschild and I'm a managing director of Schon Klinik, a highly specialized, family-owned German hospital enterprise founded in 1985. Throughout Germany, we run 15 specialty clinics. Our largest and most renowned specialties are orthopaedics, neurology, and psychosomatic. At Schon Klinik, we believe that the combination of focus, specialization, and the resulting experience are at the heart of high-quality medical care. We entrust our patients to doctors, nurses, and therapists with the experience and dedication for their specific medical needs. To give you an impression of Schon Klinik's expertise and dedication, this program features representative head physicians with the speciality of orthopaedics with an emphasis on spine surgery, as well as the treatment of children with congenital limb deformities.
One of the focuses of Schon Klinik is orthopaedics, which means the treatment of musculoskeletal diseases. And within orthopaedics, it's besides children orthopedic spine. So we run 7 spine centers across Germany. We see between 40 and 50,000 spine patients a year with all aspects of spinal pathology. And we offer all types of treatment, from conservative treatment up to surgery. And within surgery as well, the spectrum ranges from very minimal invasive to maximum invasive, for example, in patients suffering from spine tumors or patients suffering from deformities where you have to correct the spine. Usually we see these patients in our back institutes, where even patients can come without any diagnosis, so we guarantee the patients that within a short period of time we will get a diagnosis for him. So it's a multidisciplinary, more from the medical aspect, a holistic approach where different specialists, conservative orthopedics, surgeons, psychologists, radiologists, neurologists work together to establish the right diagnosis and then to bring the patient on the right treatment pathway.
Good afternoon. My name is Luca Papavero, and on behalf of the Schon Klinik Group, I welcome you to the Clinic for Spine Surgery in Hamburg. Our major expertise is the minimal invasive treatment of degenerative spine diseases such as disc herniations or narrowing of the spinal canal. We also address the effects of rheumatoid arthritis of the spine. And last but not least, we have developed less traumatizing approaches to remove spinal tumors into the spinal canal. This technology relies on the extended use of the microscopes, which allows for excellent surgical working conditions in very limited target areas. This technology means the benefit for the patient in terms of less blood loss, less post-surgical pain, and early mobilization. But of course, the real secret of a successful surgical treatment and rewarding clinical outcome is very dedicated people, which make the difference. So trust us.
You can see here, this is the endoscope that we used during the surgery, the type of endoscope that we used during the surgery. There are optical fibers inside this endoscope, and everything from the tip of the scope is transmitted to the large screens. We've got the irrigation here, we've got the working portal here, through which we can guide our instruments. And then basically from inside the spine, we can do our surgery, we can remove fragments, we can mobilize the nerve root, and we can basically do anything that needs to be done in order to perform a sufficient decompression of the nerve root. The advantages of this technique are obvious. We only need a small 5-6 millimeter incision. This is a really minimally invasive keyhole type of surgery. very minimal access to get to the spine, also minimal access and minimal scarring from inside the spinal canal. It's got a lot of advantages, also for obese patients, if you can do these types of surgeries with minimal access trauma. And the wound pain post-operatively is really minimal. So patients can mobilize 2-3 hours after the surgery, stay with us maybe for 24-48 hours, and then can be discharged from the clinic very quickly. It's a very good and attractive complementary technique to the other minimally invasive techniques that we offer, such as the microsurgical techniques.
Within the spectrum of spine surgery, the surgery of complex deformities is one focus of Schon Klinik. We run 7 spine centers, and out of these 7, 4 are focused on the treatment of deformities. Deformities occur in about 1-2% of the children and young adolescents. And in a lot of these cases, they not only mean a cosmetic problem, but it's also associated with pain. So to treat this means for most of these patients not necessarily minimally invasive, but maximum invasive surgery, because you have to expose the whole spine, you have to bring in screws and rods to correct the spine from the deformity into the right position. This also requires what we call neuromonitoring, which means during the correction maneuver, you have to monitor whether the function of the spinal cord is okay. So there's a lot of infrastructure behind the treatment of these complex diseases. Fortunately, we can provide all this in our spine centers who focus on the treatment of these types of diseases. If you look at orthopaedics, historically orthopedic has always been a specialty which was dedicated to the treatment of children in the beginning. This is why it's called orthopedics. It's a combination of 2 Greek words, which means orthos, upright, and paideia, which means education. Now, the pioneers of orthopedics mainly dealt with diseases which we do not really know nowadays, like polio, like tuberculosis. This is not the current problem. However, children orthopedics is still a very important subspecialty within orthopedics, but it requires a high level of expertise because the types of diseases we are treating with right now are very complicated and complex diseases such as cerebral palsies, or spina bifida, or congenital malformations of the limbs. So Schon Klinik runs 2 centers for pediatric orthopedics, one here in Munich, one in Vogthereuth, with specialists who are dedicated to the treatment of these types of disorders.
We are in Schon Klinik in pediatric orthopedic surgery are specialized in treatment of extreme rare diseases. These deformities are very seldom. They come about 2 to 7 in 1 million births. I mean, there are not many doctors in the world who know how to handle this kind of deformities. And the parents, after the birth, when they go to the doctors, they hear things like, we have to amputate, or I don't know what to do. That's why we're here, and that's why the people come to us, not just from Germany, but from Europe, Asia, Africa, and South America. The advantage of Schon Klinik is the network, what we have. If there's a child in Hamburg who comes from Germany or from other countries, a doctor that is in Schon Klinik in Hamburg calls me and says, hey, Dr. Nader, I think this is a patient for you. And we can concentrate in our specialties. Our work, or my work, is to help these children and the parents. And here we have a case of fibular hemimelia. It means this young man was born without a fibula. And here we had to do an operation to help him to stay active. First time the Valentine went to the clinic with his mother after the birth, the mother was told you have to amputate. And they decided not to amputate, and there was not at the time the possibility to do the correction that we can do now. Times have changed and we can do really good correction on these deformities. We can get children to stand on their own foot after they're grown up. Of course, this is a treatment that will take many years to fulfill, but they can stand on their own foot when they are 18.
The good thing about the Schon Klinik is that there's a very good teamwork between nurses, doctors, physiotherapists, and yeah, that's why I think that it's very comfortable.
You have seen some examples of Schon Klinik expertise and dedication. I have myself entrusted my parents as well as friends to those people because I know that they, as well as their teams, are very good at what they're doing. Inside Schon Klinik, we have a relentless outcome measurement as well as a very tough quality review culture within and across our clinics. This network of experts drives experience as well as outcome quality. At Schon Klinik, we only treat patients if we have the experience as well as the expertise. If we do not, we refer you to someone who has, because for us, as well as our patient, their future health as well as the medical outcomes comes first. This is why patients travel to a Schon Klinik.